Thank you for visiting the Nutrition Medicine site and taking the time to view this short video. I would like to take this opportunity to welcome you to the Nutrition Medicine Clinic. The clinic was established in 1980 by Dr. Mel Sidney Smith. Today I will explain the philosophy and approach adopted at Nutrition Medicine, what this professional team actually does, and why this approach is so important. We will also meet Dr. Mel Sidney Smith soon, and he will explain in more detail how this team addresses serious and complex health issues and chronic disease. Let me start by outlining that patients here at the clinic often have a long history of illness, and so the process undertaken is unashamedly comprehensive. This approach seeks to discover and address the underlying causes of the illness. The team at Nutrition Medicine are committed to solving the more challenging and medical issues that often confront patients and their doctors. The clinic's philosophy is investigate, inform and improve. Investigate thoroughly and consider all aspects of our patient's illness history and lifestyle. Inform the patient of what is going wrong, why it's going wrong, and what to do about it. And to improve the patient's recovery and well-being with a management plan tailored to their specific needs and modified as their health improves. Now let me tell you a little about Dr. Mel Sidney Smith. Dr. Mel is the knowledge source and the driving force behind every aspect of this unique nutrition medicine clinic. He holds various medical qualifications as a doctor, and his career has seen him work in Perth, Brisbane, Papua New Guinea, and he has taught in many countries throughout Southeast Asia. Dr. Mel has been an adjunct professor and associate professor at RMIT in Melbourne, the University of New England, and the Southern Cross University. He has also authored and delivered the Master of Nutrition Medicine program at RMIT. Dr. Mel was awarded a Doctorate of Philosophy in Complementary Medicine, and in 1992 was knighted for his services to international medicine under the Sovereign Order of St. John of Jerusalem, the Knights of Malta. Dr. Mel was also an Australian of the Year nominee for the years 2013 and 2014. Now let's go through the clinic and meet Dr. Mel himself and ask a few questions I am sure will be helpful for you. So Dr. Mel, would it be fair to say your new patients come to you because they're not getting the progress they were hoping for?
That's true. Many of our patients come to us because they find they are not recovering as well as they would have expected. However, many people also come to see us after being recently diagnosed with a chronic or complex illness that is seriously interfering with their well-being. Historically, most of our patients usually have been referred from one of our previously satisfied patients, their general practitioner or a medical specialist.
Dr. Mel, could you explain to our viewers how Nutrition Medicine Clinic helps patients regain control of their health and well-being?
At Nutrition Medicine, we offer access to sound orthodox medicine combined with advanced science-based clinical nutrition to help restore the patient's body chemistry and health status. This combined approach to healthcare has been shown to create a substantial benefit in the management and resolution of many chronic diseases.
Dr. Mel, what makes your Nutrition Medicine Clinic so unique? And what can people expect when they become a patient at Nutrition Medicine?
Patients can expect empathy, understanding, attention, and a sanctuary in which they can relax and share their concerns. We work closely, one-on-one, with each patient to gain a greater understanding of their health concerns. We also actively work with the patient and their families to achieve greater home support, a beneficial outcome, and a healthier lifestyle. This clinic does not reflect the time constraints of the usual medical clinic. The clinic is organised so that we can spend a lot of time together in consultation. Our philosophy is not time pressured. We have the advantage of being able to share precious time and converse with our patients. And this allows us to explore and investigate the many different medical, environmental and nutritional factors that may be contributing to their illness.
Dr. Mel, could you share some of your insight from your experience and how you apply it at the clinic?
I have learned how to identify the myriad factors that contribute to ill health and what has to be done to remedy these factors and restore health as much as possible. This approach requires a wide understanding of nutritional pathways, what they are, and how to apply this knowledge clinically. We also undertake thorough clinical, medical and nutritional investigations to confirm or rule out what is happening in their body. We can then inform each patient about what is really going on and what they need to do to fix their body chemistry. We create a detailed disease management plan that includes a medical, diet and nutritional supplement program that is tailored to that patient's needs. Our patients also receive a personalised folder which includes copies of patient reports, investigation results, along with specific comments relative to those reports and their progress. We find this is of great value to our patients when visiting their family doctor, as well as assisting patients to relate comments and progress to their loved ones. And of course, there is the free phone-in service for patients to report on their progress or perhaps to address any queries they may have about their medication, diet or supplements.
Well, it has been very helpful, and thank you, Dr. Mel, for your time today.
My pleasure, Warwick.
Now we've heard from Dr. Mel himself, I hope you have found this video helpful. But before I close, allow me to cover 4 points for you. As a patient, you are kept fully informed on every aspect of your health investigation, tailored treatment plan, and the process going forward. We actively work with you and family to achieve greater home support, a beneficial outcome, and a healthier lifestyle. A combined approach with your family doctor and medical specialists, and a professional and caring team dedicated to your well-being. Thank you for listening, and I would encourage you to proceed to the patient inquiry button if you or a loved one feel that the team at Nutrition Medicine can be of any assistance.